What's up, y'all? This is Carolina Doc PT, and today's video is going to be kind of a different one. I found this topic idea on YouTube, and supposedly it's a high interest topic, and so I wanted to go ahead and address this for any of y'all that might be having this question, which is, so you've had a knee replacement. Who is now the boss? Is it your physician, your surgeon? Is it your doc PT? Who's in control? Who's the boss? I thought that was a pretty interesting topic. So that's what we're going to be going into. Well, let me tell you the simple answer. Okay, I'm just going to get right to the chase. The answer to who is the boss of after your knee surgery is you. You're the one who determines who the surgeon is. You're the one who determines who your physical therapist is. You're the one who determines, are you going to go through with the surgery? Are you not? You're the one who determines, are you going to do your exercise? Are you not? You are the boss when it comes to your knee replacement. Now, an order of hierarchy as far as folks who are trying to help you with that process, that is a little bit of a different question. So of course your surgeon is going to be in control. The surgeon is who is referring physical therapy in. So you're starting the process with your surgeon. So anything that has to do with the patency of that surgery, the device itself, how it is being accepted by your body, how it is, how you are tolerating the overall process of that, that is all in your surgeon's realm. The surgeon is the one that is actually installing that knee. So he is the boss as far as the hierarchical relationship between your physical therapist and your surgeon when it comes to how that knee is functioning. He is the one who he or she, let me come back, but they are the ones that are bringing physical therapy in to work with you to continue or to get that part that they've installed moving. So when they hand that part of the rehab or the recovery, I should say, over to the physical therapist, now it is our job as PTs to make that knee move according to the guidelines that the surgeon has set up for us to meet, which he is basing off of what his experience and what the device manufacturers have told them that knee should be able to do. So then as we are following along within those precautions, usually those are mainly in effect within the first couple of weeks, and that is usually the part or the time frame when you'll see the surgeon like immediately after the surgery. You'll go back to them generally 2 to 3 weeks later, then you'll probably go back to them about a month later, and then they may or may not have you come in about 3 months later, and then sometimes there's a 6-month follow-up, sometimes not, and then sometimes you might even come in at a year follow-up just to see how things are going. Sometimes they don't do that at all. So as we're talking about this hierarchical relationship of the services that are helping you, the boss, to go through with this knee replacement surgery to help you with your knee pain, the surgeon is absolutely the one in control of that hierarchy early on. I mean, they're in control technically all the way throughout, because physical therapists can't work without that referral from them. That said, as you continue to progress, the surgeon plays less and less of a role, and it's really more in the physical therapist's hands to help you to get to a full range of motion, to get full mobility, to get full strength, to return to your activities of daily living as they were. So now, as the process continues, and as your body's accepting the knee, everything is progressing in healing healing well, then you're switching over from the surgeon being kind of the main one in that hierarchy running things over to where the physical therapist is really running things. We still are sending notes over to the surgeon, so don't get me wrong. He is still he or she is still the one who is driving that, but respectfully, I would not want to have a surgeon taking me through through my rehab. They certainly understand what is going on. They certainly understand what is required and what is needed for the patient to do. That being said, they don't do it on a day-to-day basis. Their job is surgery. Their job is installing that knee. The physical therapist's job is to get that knee that has now been installed moving and moving in an appropriate way to help the patient progress to meet all of their goals. So this is kind of a quick video, but I thought that was an interesting question because there's not really a surgeon versus physical therapy kind of thing as far as the hierarchy, as far as the boss relationship goes in the knee replacement realm, or even in the knee pain, honestly, because whether or not the surgeon has performs a surgery or not, if they go to the orthopedist and the physical therapist bring in physical therapy, then it's still kind of the same thing. But ultimately, the answer to the question is, who is the boss in this situation when you're having knee pain and when you're having knee replacements? The boss is you. Make no mistake, we, the physical therapist and the surgeons, we are trying to help you to attain your goals and to move forward with this successfully. That is our role. But I mean, you can fire us anytime you want. You can go to another surgeon for a second opinion. You can go to another physical therapist. You're the one that's in control. You're the boss. We're just here to help you to meet your goals and to successfully recover from this knee replacement or this knee pain. So I hope that clarifies for anyone that has questions about that. As I said, that YouTube defined this as a high interest question that I thought I would like to provide an answer for. So I hope that it is done so. All right, y'all have a good one. Catch you later.